hear me well? Yeah. So good afternoon. I'm Paola Hernandez. I'm the Project and Policy Officer at Healthcare Platform Europe. First of all, thank you to Son and John for the invitation, and it's a pleasure to be here. Before I dive into the topic of today, I'm gonna give you a sort of introduction of who we are and what we work at Healthcare Platform. So Healthcare Platform is a non-profit membership organization. We are an international one, and we mostly bring the voice of healthcare professionals to the European policy on different topics, and also raise awareness and inform healthcare professionals about the importance of the environment. These are mostly topics that we are covering at Healthcare Platform Europe. So from the management of safer chemicals to climate smart healthcare, access to healthy food while reducing food waste, how to provide safer pharma. So what's actually the impact of pharmaceuticals in the environment and how to reduce antimicrobial resistance, and also sustainable procurement. All of this is part of this network that actually is for more than 1,000 members representing 30,000 hospitals and health systems worldwide. And now, let me tell you a story. It's been kind of mentioned today that every 45 seconds a person in America has a heart attack. So that means that while I'm talking now, more than 30 people will have a heart attack. That seems pretty scary. And increasingly, actually, that person is younger because, of course, health risk factors are on the rise. I'm not going to mention them because I think they've been already mentioned today, but also I would like to actually emphasize as well on air pollution, because in 2018 was recognized by the Lancet as a health risk factor. So, as doctors or health professionals, what would you recommend to a person that actually has had a heart attack? So, do you think a pill can actually solve everything? It's not the only solution, and actually in some cases it's not even required, as we have seen this morning. Last year, I actually had the opportunity to visit Montefiore Moses campus in New York. In 2010, Montefiore was kind of like the usual hospital, like serving actually a lot of sugar drinks and deep fried foods. Nowadays, the scene is completely different. Now you can find actually a great variety of healthy and environmentally friendly options. This change of menu is being largely attributed to Dr. Robert Osfield, which is a cardiologist at Montefiore, who has been researching the impact of food choices on our health. He found that the increase in plant nutrition was the most impactful. So included this information with interacting with patients, with cardiovascular patients. Dr. Osfield has observed that the majority of these patients lost weight, lowered their cholesterol and blood pressure, and improved their energy levels when adopting a plant-based diet, and even reversing type 2 diabetes. Encouraged by these results, he decided actually to extend his program to other areas of the hospital. And he created the Montefiore A-stem cardiac wellness program that aims actually to prevent and reverse heart disease with a whole food plant-based diet, comprised, as we have seen, like vegetables, fruits, whole grains, dairy alternatives, nuts, etc. In this program, patients, but also relatives, learn about the benefits of the diet and are encouraged to integrate plant-based meals into their normal routines as much or as little as they want. Also, employees and visitors of the cafeteria receive similar information from poster displays in dining areas and explain the health benefits of plant-based diets. To increase access to the necessary ingredients for a health-promoting plant-based diet, and also create access to local farmers, they have actually set up a farmer market in their own hospital. And also patients get visits to farms around and also get some butters to go to nearby shops and other outlets to kind of get healthy food. So in brief, with this little story here is like Montefiore represents actually an example for what I would like to see in Europe, and that's why this is gonna be my first message today, as like prevention has to be at the center of our tables. But let's take a step back and think about what is happening in Europe actually. In line with other offices at HCWH Europe, we apply the concept of environmental nutrition because actually food cannot be defined only by their nutritional content, but also we need to look, as we are saying this afternoon, we have to look at the environmental, animal welfare, social and cultural aspects. So to illustrate this, let's take a look at this apple. The traditional nutrition approach will be asking like how much vitamin C, how much calories, how much fiber has this apple. But the environmental nutrition approach will be also asking how much pesticide has been put into this apple, is the farmer getting enough remuneration. So from this perspective, and this saying has been said today, we don't have to ask ourselves like if one apple keeps the doctor away, but what kind of apple keeps the doctor away. So taking into account this approach, at HCWH Europe, we work in partnership with European hospitals. We are in 16 EU member states, and we work in partnership with them to create better food systems through innovative plan-forward menus and local and sustainable food procurement strategies, following mostly the Green Public Procurement criteria published last year by the European Commission. So in 2016, you might have seen this report somewhere today, we conducted several interviews with hospitals. We actually selected 22 experiences from 9 countries because we thought they were actually inspirational. And what we learned from this study is that actually providing healthy and sustainable food means provide more appetizing food that will reduce consequently food waste. Patients and also employees and visitors will get greater satisfaction, and also it might shorten some recovery period of patients. From this, we came up with these recommendations for conducting like a healthy and sustainable food procurement strategy, where we also include, for example, the procurement of vending machines if we really want to cut them. And also a food waste prevention and reduction strategy, where I will emphasize mostly the education and training. From these recommendations as well, if you look at the procurement strategy, and this is also coming from one of the challenges we identify in the report, is actually that there is an ambition to procure from local farmers, and particularly in terms of animal-based products. As you may know, European hospitals still rely a lot on animal-based products, but there's this motivation as well to minimize and reduce them, not only because the environmental impact that we have seen from many reports published in the last year, but also to save money, and also because, yeah, at the end, as we have seen as well, it has many health benefits. So, given actually this growing movement towards embedding climate-friendly practices, even at healthcare, we produced in 2018 this fact sheet over here, which include some case studies from Austria, Norway, the Netherlands, and United Kingdom. And we propose some recommendations for that. For example, focus on procurement, mostly buy from local or regional sources and environmental conscious distributors, but also consider to adopt a better and meat approach, which also include, of course, like dairy and fish products. And ensure that your animal products meet high animal welfare standards and include criteria such as non-therapeutic antibiotics and also low stress minimal transportation. Also design an appealing plant-based. There is many strategies to do this, but of course I think it's important to form a working group internally in your hospital, like hunting with everyone, even patients, but also trying to combine more with vegetables, and even if you can, of course, provide a vegetarian, vegan menu at every meal, and even like consider to do a plant-based meal per week. Also, I think it's really important to be creative and descriptive, like to do like really original names, like, I don't know, crunchy carrot bites, to kind of attract the attention, mostly if you are dealing with pediatric patients. And also raise awareness and share your message both internally and externally, as we have here like every step counts, and I think it's important to communicate that. Of course, to achieve this, we have to take some considerations into account. Usually hospitals consider like healthy food is too expensive. Well, we really have to think the cost, like really how much it costs, or which benefits are we gonna get from that? Because as it's been said, like environmental externalities are not even considered in the price of what we pay for our food. And actually, I mean, is really healthy food so expensive, or is actually that unhealthy food is too cheap? So just reflect on it. Also, another main reason consumers report using meat alternative products is actually the perception that they are healthy. But there is also other social cultural aspects that we need to take into account, and more when our societies are getting more and more intercultural. So that's why as well healthcare facilities are also getting new interest in the provision of culturally prepared food to improve consumption of healthy meat, and actually investing a lot as well on culinary creativity and different strategies to offer optimal nutrition, human and environmental benefits. And finally, of course, as it's been mentioned, there is not only a consumer confusion with all the labeling, but also, as Son has said this morning, I think there is still a lot of food and a lot of lack of food and health literacy. So I think we really need to catch up on that. So in brief, it is paramount for healthcare facilities to reduce and minimize as much as possible meat consumption, mostly when it's coming from industrial sources, and support new markets for community farmers to diversify production to meet demand for whole legumes and other high protein plant foods, which offer optimal nutritional benefits and restore farmland and natural resources for future food production. Due to their significant power purchasing and trust role as authorities on health and wellness, hospitals are able not only to increase access to healthier, more sustainably produced food for patients, staff, and visitors, but also to the whole community. So for that as well, I think it's really important to connect with local farmers. And also, as I said, invest more on culinary professionals, strategic marketing, taste testing, and consumer education. So hospitals have as to model menus that center around whole plant-based food to respond to cultural needs, support sustainable farming, and encourage a clear path to a healthy diet. This is actually what the Cool Food Pledge, which is actually a collaboration between Health Chemical Farm and the World Research Institute, is trying to achieve. I invite you to consult the website. Actually, healthcare is leading the pack of this, and what it's trying to do is actually to reduce the greenhouse gas emissions from purchasing at hospitals. So finally, I just would like to highlight that institutional leadership through food on climate equity and reconciliation is a health imperative for the future, and the work that hospitals can do to influence the people upstairs, let's say, is still to be seen. That's why the rules need to be changed, and hospitals need to be seen as places not just to treat sickness, but also to support well-being in their communities, supporting health beyond their walls, their bricks, and also get out to the environment that actually is making us sick in the first place. So that's why actually I would like to make a call to all of you healthcare professionals as well, because every single day, and I repeat, every single day, you have the opportunity to model sustainable food choices for patients, employees, visitors, and markets, whether you are intended to or not. So I would like you to think what you are actually going to change from Monday on. And thank you very much for listening. And if you have any questions,